Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel, click our notification bell.
The Kaakaki Cancer Awareness in conjunction with Cornwall Cancer Foundation, and of course the conversation will be with Dr. Denise Ejo, who will be having the conversation with participants at the World Cancer Congress. She's already standing by to take over that conversation with us, with her guest.
Yeah, she has two guests who will be helping her analyze some of the issues she will be dealing with today. First is the president and CEO of BioVentures for Global Health, Jennifer Dent, as well as a professor of radiology from the University of Nigeria Teaching Hospital in Enugu, Professor Ifeoma Okoye. So we wish you a very good outing with your guests there, Dr. Dennis.
Over to you.
Hello. Okay. Good morning. Good morning, everyone, and thank you for joining us at this special edition of the Kaakaki Cancer Awareness in Geneva. You are joining me today with Professor Okoye and Jennifer Dent, who are very big stakeholders in the cancer space in Nigeria, and I would like to welcome you all to this special edition. I hope you are enjoying Switzerland.
Yes, we are doing. We are painting Switzerland blue and pink.
That's very nice. And Jennifer, I hope you're enjoying. You should be enjoying Switzerland.
I am, and it's nice to see Nigeria so well represented, and you brought the warm weather and beautiful sunshine with you. So thank you.
Really, the sunshine. We didn't really. Okay, let's take it that we got the sunshine. I think I'm going to enjoy that statement. I'd rather enjoy it than take it any other way. So I want to welcome everyone this morning. It's a very special one for us. It's the maiden event for Cornwall Cancer Foundation at the World Congress. This is the first time I am joining, and Cornwall Cancer is joining. So, firstly, I'd like to say, Professor Okoye is a professor in this medicine in radiation, right? Prof? Yes. Radiation, exactly. One of the big things about Prof, I'm going to do very different types of introductions today because Prof is our specialist in this mammogram matters. So all the ladies in the house in Nigeria, as you are listening to me, she's going to be talking to you about this importance of mammogram in our next episode. And then Jennifer is the president of the BioVenture Global Health and has continued to work in Nigeria and support the work of the medics in Nigeria. We want to thank you also, Jennifer, for joining us here in Geneva. Thank you.
My pleasure.
Okay, so I'm going to hit it first. I'm going to start off now. So, Prof, you have been attending this event. I haven't. For years. How has this year's event addressed the issues in Nigeria? As you will appreciate, I am very concerned about the need to create an awareness of the benefits of research if we are going to be able to fund cancer care for all in Nigeria in the next few years.
Okay. So the UICC has always provided a forum to meet with content experts across the continuum of cancer. And yesterday was no exception. And we had several sessions. In fact, you were spoiled for choice. You wished you could divide yourself into 10 places and in different sessions at the same time. And it cut across advocacy for early detection, which of course is one of the banes of cancer, in the high mortality and morbidity statistics that is the bane of cancer in Nigeria. A lot of late detection of cases, which makes it, quite heavy on the healthcare infrastructure. The system is overburdened because of this high late detection cases that come to the hospitals. So we need to have early detection, because it has been said and it's been documented that for low and middle income countries, if you ask the reason for the increasing mortality and morbidity in cancer, it is, if you are asked to give three, it is late detection. So yesterday there were quite a lot of sessions that dealt with preventive measures, primary prevention like vaccination, the HPV vaccination, and different countries like Kenya, I think Ivory Coast, if I remember rightly, and Rwanda. They made presentations on their experiences trying to ensure that HPV, the vaccination for HPV is made available in their communities. And some of them gave instances of having support from different sponsors and from the UICC itself and from Gavi. Then we talked about, there was quite another very interesting session on the cancer registries. And of course, the one that Her Excellency, Dr. Zina Bagudu, was in the session talking about the different ways and strategies in which we'll be able to reduce the morbidity and mortality of cancer in the low and middle income countries and in other climes. And in her position, she was able to bring in the fact that high-level advocacy, influencing of policymakers, and looking for very innovative and creative ways to bring funding into the cancer control space in Nigeria and in Africa was, very, very imperative. And she was specifically asked what is the role of social collaborations in the social media space. And she actually approached this with a lot of caution and said, you have to be very careful with the interactions you have on social media, even though it has a huge impact in disseminating your needs and in searching out partners that you would never have met if you were not in that space. So I think I will just pause for you to be able to direct a little better with some of your questions. Thank you.
Yes, thank you very much. Actually, you've done a very, very good summary of what we as Nigeria and a country in the low, medium income countries group would have benefited from the conversations that are being held, because it's very extensive. So Jennifer, as the president of BVGH, so let me explain what BVGH, BioVenture Global Health. You do a lot of work in Nigeria and across low and middle income countries. But how do you think policies that impact patients will be at the heart of conversations going forward? And I put this to you in the context of, if we have to agree, one of the conversations has been a lot around patients and patient-driven awareness campaigns and patient-driven supports and suggestions. And now the conversation is going towards, you guys need to get the patients talking and advising us. So can you take it from there and tell us what you're thinking?
Thank you very much, Dr. Denise, and a pleasure to be here. And Professor Okoye mentioned some of the important sessions at the UICC meeting that started yesterday. And I just want to echo her comments that this meeting is a particularly special global oncology meeting, because it brings together very strong representation from countries like Nigeria, who have a strong representation here, and other countries in sub-Saharan Africa. So that's, to me, really important, bringing representation, government, hospital leadership from those important countries here to Geneva to influence global policy. So UICC has convened this meeting, but the World Health Organization is a very strong partner to UICC. So when you think about global policy and influencing policy. Those two organizations can mobilize a lot of actors across sectors. And I think this meeting that we're at in Geneva this week is a mechanism to do that. Importantly, we heard yesterday, as Prof. Okoye mentioned, that Her Excellency Dr. Zainab Agudu is here. She's speaking in a number of sessions. And I just also want to highlight how she is actually pulling in other voices from Nigeria in the sessions that she has represented the country and cancer in sub-Saharan Africa, including the Honorable Chairman of Health, Dr. Sununu, who is present and was speaking about the importance of influencing policies and really driving the government and encouraging the government to do more. Just recently, a few weeks ago, we were in Nigeria for the launch of the Lancet Oncology Commission on Cancer in Sub-Saharan Africa in Abuja. And that event, coupled with events like the World Cancer Congress, I think they influence politicians to do more. And that is what will eventually influence policies. But what I think is also particularly special about this event is that, Dr. Denise, you are here as a patient, as a survivor, currently undergoing treatment. And we've heard, a great deal over the last days, and we will today and tomorrow as well, from the patients. And Prof. Okoye spoke about social media as a mechanism to raise awareness, convey that patients like you are survivors, they're champions, they're navigators to support other patients. And the voice of Nigerian women, as both of you know and convey so well, is pretty loud and pretty demanding. And so I think having this convening that UICC is leading this week with WHO in partnership, and hearing the voices of both of you, Her Excellency Dr. Agudu, and others from Nigeria, that is going to influence policy. And just encouraging both of you to keep up with the energy and the voices that you convey on behalf of patients and on behalf of all of the geopolitical regions and communities in Nigeria.
Thank you. You hit a lot of key points that have come out from this this few days. I would say few days because I think we started on Monday. Okay, so let's go. Jennifer, this is for you again. Okay, there seems to be a lot of discussion around patients. We agree with that. But how do you think we can start to design? Because one of the things that is coming up is designing models that actually are appropriate for us, because a low-income country, okay, evidence is coming out that very high-income countries have a lot of the research going on, they have a lot of the funding going on. So how do you think we can start to design a model, so I would call it the Nigerian model, which can support collaboration in Nigeria and across the low-income countries? Because from this Congress, I've noticed that low-income countries, we all have very common goals, but nobody seems to have a model. And sometimes it's always good to be the ones to start something and let people feed into it. That's what I'm trying to say.
Well, and I completely agree. Again, I just want to emphasize that this forum that the UICC is hosting, there's every sector is represented here. So I don't want to leave out the private sector and other government sectors. So the World Bank is represented here. PEPFAR is represented here. I would say all of the international pharmaceutical companies have leadership and representation here. And so bringing these different sectors together to learn about the challenges, but the opportunities to collaborate in Nigeria, I think is a first step. And I think what's really important, and the model that we've applied through our African Access Initiative, it's not taking another country's model and applying it to a country like Nigeria. I mean, frankly, I just don't think that's that will work in Nigeria. As everyone said, the patients are different, the landscape and situation is different. So it's very important to align with the Federal Ministry of Health and the government, because they are working to improve cancer care and to deliver better outcomes for patients. But then really understanding from the grassroots. So from healthcare professionals like Professor Okoye and her colleagues who have been working in the trenches in Nigeria, who truly understand day to day what hospitals, oncologists, specialists need, what patients need. I think understanding at that level what is needed and starting to deliver on what those leading oncologists, healthcare professionals are saying they need, whether it's training, whether it's skills build up, whether it's a laboratory pathology diagnostic support and training, through to access. And I think it's important to note as well that access may be fragmented to a certain degree at first, but Nigeria has 250 million people. And with success stories at the patient level and with voices that are conveying the opportunities for Nigeria, as I think Denise, as you said, really get back to when you were a child, delivering excellent healthcare to Nigerians. I think that will really drive change. And this brings it full circle back to the voice of the community, the patients that can drive change. But I think it's very important for international actors like BVGH to play a role in listening carefully. And then as our mission as an organization is to bring sectors together, bring the private sector together to better understand the market, the landscape, working with the DG of NAFDAC, Prof. Moji Adeyeyi, working at the government level, and really delivering sustainable, more affordable, high quality access is really going to be key to actually really starting to advance the cancer agenda and changing the cancer paradigm in Nigeria. And what's exciting, I'll just say lastly, is this can happen quickly in Nigeria. I mean, Nigeria moves quickly. There's nothing slow about, the Nigerians I know. So I think change can happen rapidly. And this meeting is a great opportunity to start those discussions. And you will both be the ones that really make a difference on the ground.
Thank you. Thank you. Let's hope so. Let's see how we go. Prof, driving cancer awareness. Now I know we got pink blue. So I'll be blue pink. Driving cancer awareness is now pivotal. We all have to agree. It's now we've got a lot of stakeholders now, and a lot of us are very interested in making people aware of the disease and the challenges that come with it. Okay. And it's now pivotal in planning for change, especially in the narratives. Because one of the things we have culturally is we live in a denial. Now I'm talking about generally. We either live in denial, or because of stigmatization, we're not making as much progress as we should from the messages that are going out. So can you suggest 3 things that government, private sector, so there are 2 different sets of people, can bring to the table to help improve the quality of life for the stakeholders? Because, okay, we talk about it, we're doing one now, we're trying to create awareness, but the quality of life of stakeholders is really the bottom line. If not, there's no real point of us having the conversations. Prof, that's for you. So
I would think that working across board to make sure that the entire continuum of care for cancer is properly outlined, properly protocoled, and the cancer control program, 5-year cancer control program that is already on ground, reviewed just a couple of months ago for the 5-year cancer control program, to see how we can roll it out in a systematic sustainable way that filters not just in the tertiary care level or in the secondary care level, but down to the primary care level. So we are looking at how are we going to sustain a number of things that are already taking place in Nigeria. There has been a lot of protocoling of the different disease states for the major cancers in the country, and there's the ChemoSafe. So in the tertiary level, there's a lot of effort that is going on. The infrastructural deficiency at that level is still huge because of the huge population we are dealing with. And of course, some of the funding models we've been using focused on only funding from government. But now, with a lot of public-private partnerships, we are seeing an influx of more infrastructure that will be able to handle the efficient management and care of the patient that arrives in the hospital. So, but the point is that even the little infrastructure we have in our hospitals are still not optimally utilized because our patients are coming late. And there are a lot of them that are not even coming to the hospitals. So we still have to go back to that basics, go back to the primary health care level where we are dealing with families. And we have the CHIPS program under the primary health care infrastructure that we need to develop and make sure that they are operative across board in the different communities in Nigeria and all the different states. Because there we can develop, we had a visit to Ethiopia, and the equivalent of the CHIPS program in Nigeria is what they call the healthcare army, the women healthcare army. So these ones interface directly with families at the family level. And we need this critically because the narrative in cancer is so frightening. Everybody is afraid of the word cancer. Why? Because all they see is that somebody receives a cancer diagnosis and the next thing is death. So we have a situation in Nigeria where if you reveal that you've received a cancer diagnosis, people start paying you condolence visits. And to live with that is that in the reality that people, when they see you, you are a sympathy case. So the stigma starts from there. And then you find families where maybe a woman has a breast cancer and they are all in the know, but they're hiding it from the rest of them because they're afraid that if people get to know that somebody in the family has breast cancer, they'll be ostracized in terms of your daughters will not get married because they think, of course, it's genetic, but it's genetic, of course. But people who don't have genetic relationships also have breast cancer. So we need to begin to educate the public, go down to the rural communities and the grassroots and educate them and teach them. But the primary reason for that is so that they can embrace early detection. Now, we are working at the Cancer Health Fund to assist to pay for bills for the patients. The National Health Insurance Scheme is also working to make provisions for treating patients. And some of the pharmaceutical companies are collaborating with both the Cancer Health Fund and collaborating with the National Health Insurance Scheme to see how there will be synergy to bring in more funding into the space of treating indigent patients. So with that in place, we need to upscale our awareness in the local community so that we harness earlier cases who can survive and who can, over the next 5 years, will be able to create a considerable pool of survivors who can share their positive stories, who, like you, can be advocates, can be there, strengthening the fort, encouraging those who have it to come out and become voices in the environment that people would hear and know that, oh yes, you can actually live with cancer, just as you live with diabetes, just as you live with hypertension, which of course they all share risk factors. Now, when we go to the communities, I usually don't want to tell people I've come to talk to you about cancer because they will run away. So when I go to the communities, I say, I've come to talk to you about non-communicable diseases, of which diabetes is one, hypertension is one, stroke incidence is one, and then I slip in cancer. But at that time, they're already relaxed to hear. And you're able to tell them that there are lifestyle modifications you can adopt that will reduce your risk. And there are certain steps you can take, proactive steps you can take to make yourself available to have earlier detected cases. You can imagine that a disease like cervical cancer that is totally, you can have avoidable deaths, that 26 women are still dying every day in Nigeria from cervical cancer. Women are still coming in late, at late stages of stages 3 and 4. And yet we have screening facilities, we have, early detection methods, and, almost strewn all over the country, being supported by different organizations like Clinton Health Foundation, the WHO collaboration that we know that has, filtered into at least 7 states at the moment. So there is a lot of effort, but we need to bring synergy. We need to forge partnerships. And also, we need to change the narrative. That is so critical. Otherwise, we'll be playing at the top, at the tertiary care level, improving things, having multidisciplinary teams, intervening, and yet our patients are still coming in late, at which time we are not able to. And then we need to bring science into advocacy. There are a lot of NGOs that are out there doing a lot of work in the communities, but they do not have data to support the work they're doing or to bring to the fore the results they are pulling in. So we need to develop an ability for that to happen. Thank you.
You actually addressed so many things. There was one question I was going to ask you to finish up, but you've really told us quite a lot. And a lot of the things are very key in understanding the narratives. And one of the things I think is very important in Nigeria is for all stakeholders to understand the different or the changing narratives and understanding that positive comments, positivity really takes us a long way than the stigmatization that comes with the disease. So I'm just going to give you one shot now. Jennifer, give us one specific thing that you think we should do in Nigeria that will make things fast, make a difference fast. This is, what is this? This is October 2021 and 2022. I will come back to you in October 2023 by the grace of God, and you will see where we are. And give me one thing that you think we should do. One. As I close up.
Are you starting with me?
I'm starting with Jennifer. I'm starting with you.
Well, I would say partnership. Welcome partners across sectors, but drive the narrative for Nigeria. So don't let outsiders, which I don't think Nigerians do, outsiders should not be telling Nigeria what they need for their cancer control, in their cancer control plans and programs. It should be Nigerians that are driving the agenda and partners that are coming in to help to enable that agenda.
Thank you. That's spot on. We should be driving this change now, okay? Prof, sharp, one more.
Sharp, I will say that we need to have a structured plan to cascade concerted efforts like we did for Ebola. And everybody got to know about Ebola and what they needed to do, where to go, how to do what. We need to do that, have a concerted effort that reaches all the 774 local governments that we have presently in Nigeria. If we do that, then we are also building strengths through the intervention of the National Assembly to build up a treatment fund that will be able to assist through the National Health Insurance Scheme and that treatment fund to ensure that all those we pull as early cases are taken care of, and we're able to create a massive number of people sharing their stories. But not only that, the early cases also drive the science. We are hindered in improving on our personalized medicine because the patients are not coming early enough to create that tool that will be needed for personalized medicine development in the country.
Let's hope that people like me and those that have the disease will start to talk about it and recognize that we do have. But I have to say a very big thank you to both of you for joining me here from here, this sunshine town of Geneva. Meanwhile, my own sunshine is not coming through the window, or is it me that didn't put my lighting very well? I don't know, but I want to thank both of you very much for coming, for joining in this conversation. I'm going to thank AIT for allowing us to be able to air this conversation while here in Geneva. Thank you, both of you, for everything. For everyone out there, we want to say thank you for joining us today. Follow us on Common Cancer Foundation. You can find us on Instagram, Facebook, on our website. Just look for us. You will always find us. Share, subscribe, and check the videos. It always tells you information. Please, to those who are going through the disease, if you don't know what to do, just go there, look for the disease you're looking for, and check the information that is available, and you can go from there. You will navigate. But together we fight, together we win. Cancer is a disease, but we all have to make a difference, and we hope to make that difference. I want to thank you, ladies, for joining us today, and have a fantastic day in Geneva. And I hope to catch up with you very soon. On the other side, that means in the conference. Thank you.
Thank you very much, and bye-bye.
Bye-bye.
Hi to you too, Dr. Dennis. Thank you so, Dr. Ejo, thank you so much. for always, getting us that information out there. And while that conversation was going on, I remembered one woman I met somewhere.
You were saying so.
Yeah, who survived cancer, breast cancer. And if you look at her, she looks so young, so smart. And she told me she was already at stage 4.
Wow. And it was done in Nigeria. She was treated in Nigeria.
And the interesting part, she was living in Canada, but she was treated in Nigeria.
Fantastic.
I guess she's someone that Dr. Dennis should actually have on this show.
Absolutely.
To give inspiration to so many people who are under pressure of the disease.
Sure. I think that post-cancer care is also important. We're talking about, trying to live a balanced life, exercise well, eat right, maintain a healthy body weight and sleep well. Well, for us here, there's no sleep at all. It's time for us to bring you entertainment, and entertainment is up next. Stay with us.
Good morning, Nigeria.
To watch. Love at first sight, Uncle.
Oh dear. All right, entertainment package there. Just to douse the tension after all the political and the strong talks, on the day. But we thank you for being a part of the show. Let's do it again on Thursday. I'm Nkoli Omodu.
And I'm yours truly, Adora. Have yourselves a wonderful Wednesday and goodbye. See you again tomorrow.